Hello everyone, my name is Dr. Madhushree, Assistant Professor from the Department of Periodontology, Vinayaga Mission Sankaracharya Dental College, Salem. So today I am going to talk about mechanical plaque control. So what we are going to see under mechanical plaque control is, we are going to talk about the introduction, the mechanical plaque control, toothbrush, interdental cleaning aids, dental floss, interdental brushes, toothpick, oral irrigation and dentifrices. So moving on to the introduction, so before going into what mechanical plaque control is, we should know what plaque is. So according to WHO in 1978, it is defined as specific but highly variable structural entity resulting from colonization and growing microorganisms on surface of the teeth and consisting of numerous microbial species and strains embedded in a extracellular matrix. So given that 1 gram of wet weight of dental plaque will contain about 10 to the power of 11 bacteria. So why we need this plaque control? When we leave this plaque left as it is, it might lead to gingivitis and periodontitis. So to prevent us from getting induced into gingivitis and periodontitis, we need to have measures as plaque control. Plaque control can be of two various types. One is your mechanical, the other one is your chemical. So moving on to what are the types of mechanical plaque control, we have the toothbrush, we have the interdental aids. Apart from that, we have something called as the oral irrigators and as well as the toothpicks. So moving on to the chemical things, what do we have under the chemical plaque control? So we have mouthwash, we have antibiotics and we have got enzymes. So what is actually mechanical plaque control? Mechanical plaque control is the removal of microbial plaque and the prevention of accumulation on the teeth and the adjacent gingival surface by the use of toothbrush and other mechanical hygiene aids. So mechanical plaque control is measured by the oral hygiene effort of an individual patient. So it is the most important predictive factor in determining the overall prognosis of the treatment therapy. So it is an effective way of treating and preventing gingivitis and periodontitis. To summarize this, what mechanical plaque control is, what it does basically is, what we are going to do as an individual, as a patient, as ourselves, what can be done by ourselves to prevent the accumulation of plaque that can get mineralized into calculus and get converted into gingivitis and periodontitis. Whereas chemical plaque control is done in patients where they will be visiting the dental office and getting treated there. So moving on to the objective of mechanical plaque control. So it is the complete daily removal of dental plaque with a minimum effort, time and the devices using the simplest methods possible by ourselves. So the most widespread means of actively removing plaque at home is toothbrushing, as was done by all of us. So these are the various mechanical plaque control measures and instruments that is used by us. So we have the toothbrushes, we have got the interdental aids, the aids for gingival stimulation, tongue cleaners and others. So what is under these toothbrushes? So we have various types of toothbrushes. We are going on with the manual, then we came across the electrical toothbrush, then we had the ionic, chewable, ecological, end-tuft brushes, Selka brushes and then we had the beam toothbrushes. Now even we have the smart toothbrushes as well. Then moving on to the interdental aids that can be used to remove the plaque. So we have the dental floss, we have the triangular toothpicks, we have the interdental brushes, we have the yarn, we have the super floss and the perio aid. So rather than removing the plaque from the tooth surface, we also need to use certain mechanisms to stimulate our gingiva. So what can be used in those things? We have the rubber tip stimulators, we have the balsa wood edge, then other things such as in cases of recession, in food lodgement cases, we can use the gauze strips and oral irrigating devices which is coming up recently. Next, what we have is historical perspective of toothbrush. So moving on to the various aids that is used in mechanical plaque control. First we are going to see about the toothbrush. What is toothbrush? So toothbrush is a device that is used by us to remove the plaque and calculus present on our tooth surfaces. It was initially introduced by the Chinese in the year 3500, that was the chew stick, and later on got developed. In 1938, we got the first nylon brushes, that is a synthetic nylon brush was introduced in the year 1938. Then we had the Broxodont electrical toothbrush that was introduced in 1954, and so on. From there we have gone on developing the various types of toothbrushes, and in 2014 we have the latest one, that is a smart toothbrush. There are certain specifications given by toothbrush according to the ADA. So the American Dental Association gave the various specification of toothbrush. We have the length, width, surface area, the rows, tufts and the bristles. So according to it, the length is supposed to be 1 to 1.25 inches, the width is supposed to be 5 by 16 to 3 by 8 inches, the surface area is supposed to be 2.54 to 3.2 centimeter square, number of rows is supposed to be now 2 to 4 rows per brushes, and then we have 5 to 12 per row of tufts and 80 to 85 per tuft of bristles. Moving on to the different types, that is your manual toothbrush and the electric toothbrush, as the name suggests. So manual toothbrush is a device composed of shaft and a handle that uses the natural or synthetic bristles and intends to remove the plaque and food debris from the teeth that is used by us, and manually we have to give the movements. Whereas the electric toothbrush is an electrically powered or battery powered device that consists of the same such as your a manual toothbrush. The only difference between this electric toothbrushes, the movements are given by the device itself rather than us performing those movements. Based on the different types, the toothbrush can be classified. So first, how we are going to use it. So whether it's going to be manual, it's going to be powered, it's going to be sonic or ultrasonic, ionic or chewable. So based on the manipulation, these are the types how the toothbrush is being classified. And then moving on to the diameter of the bristle. So we have the soft brush that contains of 0.2 mm, that is 0.007 inches of diameter of your bristle, medium brush that contains 0.012 inches, and then the hard brushes that got 0.14 inches, and then out of which the recently one is the ultra soft brushes which has got 0.075 mm. Based on the size of the toothbrushes, it can be classified as large, medium and small. So large is the one that we have been regularly using, and the small type of toothbrush is used by the pedo patients or the small kids. So moving on to what are the parts of the toothbrush. So as we can see here, so we have this so many things. So we have first is the brushing plane. So the whole thing is called the brushing plane. From this end to this end we have got the head, from this to this we have got the shank, and then we have got the handle. So the shank is in place where it connects the head and the handle. So in head we have got something called as the toe, that is the tip of the head, and the heel that is at the bottom of your brush. In this we can see this is the cross section, another cross section. When we have the brushing surface, we have got the head, the shank that is for triangle, then we have got the handle, and then we have got the tuft that is placed in the head of the regions. Moving on, what are the bristles? So bristles are nothing but the device that is placed on the head of a toothbrush that is used to effectively remove plaque and the food debris. So the bristles, it can be either natural or artificial. So the natural bristles are from hogs, so they can fray, they can break, they can soften, or loss of elasticity, contamination with microbial debris. All these are some of the disadvantages from the natural bristles that are derived from the hogs. So we moved on to the artificial filaments that is made from nylon, or which are much more superior than the natural filaments. So these are grouped into tufts that are arranged in 2 to 4 rows. The brush is either uni-tufted or multi-tufted. So the bristle's hardness is proportional to the square of the diameter, and it's inversely proportional to the square of the bristle length. So the greater the diameter, much more harder it is, the longer the softer. So the best estimate of actual manual brushing time is to range between 30 to 60 seconds. So it is optimum of 2 minutes is required to remove the plaque completely, and it has reached both with manual and the electric toothbrush. So there is no much difference between the manual and the electric toothbrush, provided manually the action or the mode of action of the brush strokes is done properly. So moving on to what is toothbrush wear and the replacement. So it is generally recommended that the toothbrushes being replaced before the first signs of filaments becoming what. So before even it starts to spray, when we get to notice the first bristles are starting to worn, we are supposed to replace it. So the average life of a toothbrush is estimated to be about 2 to 3 months, and not all patients like this advice, because an evidence indicates that the average age at which a toothbrush is replaced ranges from 2.5 to 6 months, which is really long time. Okay, then we move on to the electrically powered toothbrushes. So it is also designed to mimic the back and forth brushing technique, and it relies completely on the mechanical contact between the bristle and the tooth to remove the plaque. So the addition of low frequency acoustic energy, it generates a dynamic fluid movement and providing cleaning slightly away from the bristles and the tubs. What are the uses of these electrical toothbrushes? So the electrical toothbrush is used in small children, it's used in handicapped patients, hospitalized patients, patients with orthodontic appliances, preferences of patients because they were or not effectively using the manual methods, and patients lacking a fine motor skills. So these are generally recommended for individuals who cannot perform a manual dexterity of the required movements from a manual toothbrush. So these electrical toothbrushes perform by themselves. Moving on, what is a sonic powered toothbrush? So these are the types of toothbrushes that produce high frequency vibrations, that is around 1.6 megahertz. This leads to the phenomena of cavitation and acoustic microstreaming. So this phenomena aids in stain removal as well as disruption of the bacterial cell wall, that is the bactericidal activity, because of the cavitation and the acoustic streaming effect. Next, moving on to the ionic toothbrushes, that is electric toothbrushes are different and electrically active ionic toothbrushes are different. In this, all these electronic ionic chips are placed in which it helps in the reduction of the hydrogen ions in the organic acid of the plaque, which may result in the decomposition of the bacterial plaque. Okay, so we'll just summarize between what is the difference between a manual and a power toothbrushes. So when we move on to the power toothbrush, that is which is placed on the left side, it has good with braces. It's a timer plus pressure sensor is there, so it will not wear off your tooth. It makes brushing for fun for children. It takes the guess out of brushing. Then it's prevent gum recession caused by over brushing, so it makes it easy to get the job done right. Whereas the manual toothbrush is also effective provided you have used the right brushing technique, you use the right force and the strokes. So in this, brush at least 2 times per day for 2 minutes each. So if you already brush and floss, well, an electric toothbrush is not at all necessary. Moving on, what are the different types of toothbrushing methods? So we have the horizontal toothbrushing, that is called as the scrub technique. Then we have the vertical brushing, that is Aliana technique. Then we have circular brushing, vibratory techniques, roll technique, and the modified Stillman technique. In this, we are going to see what are the different things. So the roll method or the Phones method is a large, sweeping, scrubbing circles in an occluded teeth with the toothbrush held perpendicularly to the surfaces. So the advantages, it's easy to learn, there is no subgingival plaque removal, but it's recommended for highly in children who cannot perform the other activities. So it's basically in circular motion on the tooth surfaces perpendicular to the surfaces. Okay. Next one, we are going to see the horizontal, that is a scrubbing method. So in this, the bristles are held perpendicularly to the surfaces in an occluded teeth. It's also easy to learn, but it's not at all efficient, and it is recommended for small children who cannot perform the other recommended methods. Moving on to the Bass method. So Bass method is a vibrating movement of the bristles placed in the sulcus with a light pressure angled at a 45 degree to the tooth surfaces. So it is an efficient in supra and the subgingival plaque removal. It can cause gingival injury when used or misused, and it is recommended for people with healthy periodontium. So modified Bass method is the most acceptable and the efficient way in removing the plaque. So we have it is same as the Bass method, except for the fact that finally after 20 strokes given from on 3 tooth per time, the final movement is done where it is sweep, that is the bristles when placed inside the gingival sulcus is removed at the end of the 20th stroke. So it is same as Bass method. The sweeping increases the efficiency of intraproximal plaque removal. The Stillman method is when the bristles are placed on the gingival and the tooth surface in the same orientation as the Bass method. So, it helps in the gingival stimulation, it helps in effective removal of subgingival plaque and is recommended for patients with advanced recession. So, modified Stillman is same as Stillman's method except with it's combined with a sweeping motion, same as in modified Bass method and the Bass method. So, next we have the Charter's method where the bristles are held towards the occlusion in 45-degree angle. In Bass method we saw that the angulation was 45-degree to the tooth surface, it is in this towards the sulcus, this is towards the occlusion. So, these are the difference between your Bass method and the Charter's method. So, it is an effective interdental cleaning, but it is hard to achieve and it is usually recommended for patient with periodontal surgery. So, let us brief about the Bass technique or the sulcular brushing. So, this method emphasizes cleaning of the area directly beneath the gingival margin. The head of the brush is positioned in an oblique direction towards the apex. The filament tips are directed into the sulcus at approximately 45-degree to the long axis of the tooth. So, basically the bristles are placed at an angle of 45-degree into the sulcus of the tooth. So, the brush is removed and moved in back and forth direction using short strokes without disengaging the tips and of the filaments from the sulci. So, we are supposed to use approximately 20 strokes, 3 tooth per time. So, on the lingual surface in the anterior regions, the brush head is kept in a vertical direction. In this we can see that here the brush tips are in the palatal region where it is placed in the gingival sulcus. We can see that the filaments or the bristles are placed inside the sulcus at an angulation of 45-degree and we are giving the back and forth motions approximately 20 strokes, 3 per tooth, and then finally in the modified Bass technique we sweep it out so that the gingival sulcular area is being cleaned. In Charter's method what we see is here we can see the direction is towards the sulcus. In Charter's method the direction is towards the crown. So, that is the basic difference between a Bass method and the Charter's method, and in both the methods it is modified as the sweeping motion. So, the Bass technique is widely accepted as an effective method for removing plaque not only at the gingival margin but also subgingivally. So, it is mainly indicated in progressive gingival recession and root exposure and to decrease the abrasive tissue destruction. So, these are the things that we have seen about our toothbrushes. So, we saw what is a manual toothbrush, what is an electrical toothbrush, we saw what is sonic, and then we moved on to the different types or techniques of toothbrushing, and then we finally saw the advantages and disadvantages. Now, moving on to the interdental cleaning aids. So, why basically is an interdental cleaning or interdental aids necessary in an oral hygiene maintenance? Because it has been in a study conducted, it has been observed that the toothbrushing technique cleans only 58% of your plaque. The overall plaque removal is not being completely removed only with the toothbrushing technique. So, interdental aids such as dental flossing, interdental brushes, wooden tips, oral irrigators, all tongue cleaners are necessary to remove the complete accumulation of plaque in an oral cavity. So, toothbrushing alone is not going to help in the complete removal of plaque and the food debris in our oral cavity. So, the purpose is to remove the plaque and not to dislodge fibrous threads of food between the teeth. So, indication is for ideal plaque control, toothbrushing should be supplemented with aids that assist in cleaning interproximal surfaces. Interdental cleaning, what is it? So, the toothbrushes does not reach the proximal surfaces of the teeth as efficiently as it does for the facial, lingual and the occlusal aspects, nor does it reach into the interproximal area between the adjacent teeth. Hence, the measures of interdental plaque control should be selected to complement plaque control by toothbrushing. So, here we can see the various types of interproximal cleaning device. So, the first one is we have the wooden tips. So this is also with the handle, we have the wooden tip. Next we have the interproximal brushes. So you can see a brush like pattern which is being tifted along a metal wire, and then we have the gingival stimulator or the rubber tip stimulators. So this is also a type of your interproximal brush. Moving on to the first thing, that is your dental floss and tape. So for all the methods that has been used for removing interproximal plaque, dental flossing is the most frequently recommended technique. So what we can see here is a thread-like structure that is being present and that is used in the interproximal region to remove efficiently plaque and the food debris. So the floss is available as multi-filament nylon yarn. So it can be twisted or non-twisted, bonded or non-bonded, waxed or unwaxed, or thick and thin. So basically all this has got its own advantages and disadvantages. Waxed and unwaxed is, waxed as the name suggests, it has got a coat of waxing on it. So it helps in the easy movement between your interproximal area. So recently we have got pervert flossing devices that has been introduced, and it facilitates in flossing a special floss holder that may be used and reused and is normally made up of plastic material which is durable, lightweight and easily clean. This has been introduced because when we use a floss, it can be used in two methods. One is your spool method, another one is your loop method. In both these methods, what we do is we take the floss and around some 8 to 12 inches and we move it around our fingers and then we place it interproximally. When we have these holders, it's not necessary for us to use those techniques and rather use the handles that has been provided. Moving on to the interdental brushes. So interdental brushes were introduced in the year 1960s as an alternative to wood sticks. So they are effective in the removal of plaque from the proximal tooth surfaces. The interdental brush consists of a soft nylon filaments that has been twisted into fine stainless steel wire. So the metal wire can prove to be uncomfortable for patients. So interdental brushes represent the ideal interdental cleaning tool, especially for periodontitis patients. So interdental cleaning methods is recommended where? So here we can see that the embrasure gap is very narrow. So the gap between the contact point and the gingival margin is almost nil. So in these places we use dental floss, a very small wood stick, and then we have the moderate papillary recession which has got slight open dental interdental space. In this region we use wood stick or small interdental brush. Then we have a complete loss of papilla in this region where it has got wide embrasure space. It can be because of the diastema, extraction diastema, furcation or posterior surface of most distal molar or root concavities or grooves. In this, a single tufted or end tufted brush or a gauze strip is used. So what is a single tufted and an end tufted brush? So these are designed with smaller brush heads that have a small group of tufts or a single tuft around 3 to 6 mm in diameter that can be flat or tapered. So the handle can be straight or contraangled that permits easier access to the lingual and the palatal aspects. So these are designed to improve the access to the distal surface of the posterior molars, tipped or rotated or displaced teeth, to clean around and under a fixed partial dentures on pontics in orthodontic appliances or precision attachment, and to clean the teeth affected by gingival recession and irregular gingival margin or the furcation involvement. So a single tufted brush or end tufted brush is highly used where the space between the two teeth is more or there is involvement of grade 3 or 4 recession along with furcation involvement. So what are these wood sticks? So the key difference between wood toothpick and a wood stick is that here the wood sticks are triangular designed. So this would sticks when inserted interdentally with the base of the triangle resting on the gingival side, and the tip is pointed occlusally or incisally and the triangle against the adjacent tooth surface. So, it basically snugly fits the interdental space, thus not harming the adjacent tissues. So, moving on to the gingival massage. So, massaging the gingiva with toothbrush or an interdental cleaning device produces epithelial thickening, increased keratinization and increased mitotic activity in the epithelium and the connective tissue. So, improved gingival health is been associated with interdental stimulation, which is much more likely as a result of plaque removal than gingival massage. So, and massage helps in stimulation of blood through the soft tissues. What are the other adjunctive aids or the interdental aids that can be used? So, we have the water jet, that is a dental water jet or the oral irrigation devices. This can be again classified as supragingival or the subgingival irrigation. So, as the name suggests, what we can see here is a water jet has been released supragingivally. In this, the tip is angulated and the irrigation is done subgingivally. So, it has a pulsating hydrodynamic force that is produced by irrigation that can rinse away food debris from the interdental space and plaque retentive areas. Moving on to the tongue cleaners. The dorsum of the tongue with its papillary structures and furrows harbors a great number of microorganisms. So, we can see the tongue coating that is usually seen in patients. So, patients who complain with halitosis generally are found to be having tongue coatings. So, it forms a unique ecological oral site with a large surface area. The tongue bacteria may serve as a source of bacteria dissemination to the other parts of the oral cavity, example for the tooth surfaces, and it can contribute to dental plaque formation. Therefore, tongue brushing has been advocated as a part of daily home oral hygiene together with toothbrushing and flossing, as it has a very high chances of bacterial accumulation at the dorsum surface of your tongue. Tongue brushing has also been advocated as a component of the so-called full mouth disinfection approach in the treatment of periodontitis. So, cleaning your tongue is an essential part of your maintaining oral hygiene. Moving on to dentifrices. What is dentifrices? So, the use of toothbrush is usually combined with dentifrices, that is your toothpaste, nothing but the toothpaste, with the purpose of facilitating plaque removal and applying agents to the tooth surface for the therapeutic or preventive reasons. So, a toothbrush is used with the use of dentifrices. It is an abrasive and a polishing material that prevents a harbor of your microorganisms on the tooth surfaces. So, what is the composition and what are its each function? So, detergent. So, it is 1.2% sodium lauryl sulfate. So, it is used to lower the surface tension and penetration that enables in loosening the surface deposits and strains of your microorganisms. So, it emulsifies the debris for easy removal by the toothbrush and it contributes to the foaming action. So, detergent is to prevent the surface tension and for foaming or the emulsification. Next, we have the cleaning and polishing agents. So, it has got 20 to 40% of calcium carbonate or calcium pyrophosphate or bicalcium phosphate. So, its uses acts as an abrasive agent for cleaning and polishing objectives. Next, the polishing agent is used to produce a smooth, shining tooth surface that resists discoloration, bacterial accumulation and the retention. Next, we have got the binders. There is 1.2% of organic hydrophilic colloids, alginates, magnesium aluminum silicate, colloidal silica. It is used to prevent the separation of the solid and liquid ingredients during its storage. So, basically, as the name suggests, binders binds the solid and the liquid ingredients during a storage procedure. Next, we have got these humectants, that is your 20 to 40% of glycerin or sorbitol. It is used to retain the moisture it prevents the hardening on exposure to air, and it also stabilizes the preparation. Next we have got the preservatives such as the alcohol, formaldehyde or dichlorinated phenols. It is used to prevent the bacterial growth and to prolong the shelf life of our toothpaste. Next we have got sweetener, that is 2 to 3% of your sorbitol, or it can be sodium saccharin, sorbitol, xylitol, and it is used to import a pleasant flavor for a patient acceptance. So we have got the strawberry flavors, mint flavors, all these things which will enhance or will be much more comfortable for us to use during its usage. Next we have got the flavoring agent, that is 1 to 15% of peppermint. It can be of cinnamon, menthol, mint, etc. It helps in making the dentifrices desirable, it to make the other ingredients that may have less pleasant flavor. Next we have the therapeutic agent, that is 1 to 2% of your fluoride. It is for the medical value. Then we have the coloring agent and the water, that is a main transport medium. So what are the importance of instruction and motivation in mechanical plaque control? So mechanical plaque control demands an active participation of an individual subject, and therefore the establishment of proper oral home care habits is a process that involves and depends upon the behavioral changes to a great extent. So it is not only what we can tell them or what we can suggest them, it is up to the patient's motive and their improvement and their desire to maintain a plaque control. So when implementing behavioral changes, dental professionals should try to ensure that the patient recognizes his or her oral health status and the role of his or her personal oral hygiene procedures in the prevention of caries and the periodontal diseases. So oral hygiene instruction should also include components such as self-assessment, self-examination, self-monitoring and self-instruction. So all these has to be enhanced among the patients to achieve a complete oral hygiene. So moving for the conclusion, gingivitis is a reversible disease of the oral cavity. So many adjuncts may assist in the control of pathogenic dental plaque to prevent diseases or to reduce its expression. So mechanical plaque control through effective oral health behavior remains the essence of effective management of the disease. Regardless of the means, mechanical plaque control is a key to the success of periodontal therapy and achieving our dental health. So it is the dental professional's responsibility to train the home regimen to improve compliance and to meet the needs of special patients group. Hope you all have understood what mechanical plaque control is. So we have found about what toothbrush is, then what is the electrical toothbrush, manual toothbrush, ionic and the power toothbrushes. Then we moved on to the interdental aids such as your dental floss. Then we had what interdental brushes used. Then we moved on to what end tufted brushes. Then we saw what is floss. Then we saw what is a wood pick, gingival stimulators, tongue cleaners, and then we came finally to our needs and essentiality of our interdental aids along with the toothbrush. So by maintaining a good oral hygiene, gingivitis can be reversed and we can enhance a efficient plaque control method. Thank you. Hope you all have understood the lessons and thank you for watching the video. Thank you.